Due to the graphic nature of this program, viewer discretion is advised.
Get him on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
So this is x-ray of Archie. Archie is a little schnauzer that got out of his yard. The gate was open. They didn't realize that he ran out of his yard and got hit by a car a couple days ago. When he first came in the middle of the night, he was in shock, so they had to treat him for shock with IV fluids and getting his blood pressures up with different types of fluids. And then they were worried because he could not walk on either of his rear limbs. At that point, because he was so unstable, they told the owners that we're going to proceed ahead, knowing full well that, you know, he can't walk on his back legs yet, so they didn't know what was going on at that point. As they went on through the night, they got him stabilized, and then they found that this is him laying on his side, his spine here, his tail here, this is his abdomen, and they saw that he had a hernia, which is, if you look, here's the abdominal wall, and then there's a disruption in the abdominal wall right here, and there's abdominal contents laying outside the abdominal wall. Usually this continues right along like this. And today they're going to go in on the surgery and fix that hernia, that inguinal hernia. So that's what they're going to do today. As you can see, he's bruised everywhere. And this is where he lost a lot of blood. This is the right leg was actually out of the socket. The inguinal hernia is right in here. They haven't scrubbed yet. Is right in here, and so they're going to have to cut here and put the intestinal loops and the bladder back into place. I'm pretty sure that's what's out here, and close that inguinal canal so that he doesn't have a problem in the future and all the abdominal organs stay in place there.
So I'm doing a sterile scrub right now, right before surgery starts. So basically the method we like to use is you start inside and you work your way outside as to not recontaminate any area that you've wiped already. This is just kind of a pre-scrub before the doctor is able to come in here and start doing her thing and cutting and opening her packs and things like that.
So that is the herniated area. You can see some intestine right here, and the area that is supposed to be closed is where my finger is. That's how much impact and trauma was caused when this dog was hit by a car. So we are going to close this up and repair the wound. This is a major tear. This is huge. So here is a better view of the hernia, and basically the muscle just tore. We've got shredded muscle right here, and here is the body wall, which the intestines just popped right out of. This is a humongous hole, and we are going to suture this up. It's going to be a very delicate surgery because the muscle is very, very torn. So good thing we have 2 people in here. This is a definite 2-person surgery. This is horrible. We are closing this space up. Unfortunately, the dog's body didn't read the book on the proper anatomy of the body wall when this blew, so we are trying to piece this back together as best as we can. Dr. Seno is pushing the intestines back in as I am suturing. So good we are doing this surgery and did not wait. The adhesions in here would be so bad. Alright, so Archie is waking up from the procedure. We removed the endotracheal tube and he's just sitting here recovering. We're getting his cage ready. The incision is right here, and the length here that you can see, about 6 inches, shows the level of herniation that we were dealing with. Unfortunately, the hernia was larger than we had anticipated, and there was a lot more damage to the body wall. We basically had to reconstruct the body wall to the best that we could, and the dog is waking up, and we're gonna see how he walks, everything like that. He did have some weakness with this right hind leg, and now that we were able to determine the extensive nature of the herniation site, it's possible that there could be some damage to the nerves and vessels going to this leg. That might be why it was weak. So hopefully the fact that we were able to put everything back will help him to heal and get him on his way.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, we're always on the level, and Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world in our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. PAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. PAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel. Personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mukwonago, which boasts a fully matted 5,200 square foot training hall. While in Mukwonago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
So fortunately, Archie went home today. He's healing very well cardiovascularly. He's very stable. His blood pressures are normal, heart rate is normal. We actually had him up now 3 times today, standing on his back legs. And the owners are going to work with the rehab specialist here, Dr. Jamie Mabius, and she's going to be working with them on how to help him stand and continue with working with making him walk on those back legs. And then we're going to be monitoring his incisions and his wounds, and we'll be seeing him several times, but we're very happy that he went home today, and so are the owners. So how's it going?
All right. He's got a lot more energy, so that's good.
Yeah, we need to check him out so that he can go at home.
Oh, is he going to the bathroom okay?
Not much, but he's not eating or drinking very much.
Gotcha.
So I think it's proportional.
And you're trying hamburger and chicken.
We tried some hamburger. He didn't care about that. He did, before we left, she gave him like 3 handfuls of treats, and he ate all of those. They're like jerky style thing, so I don't know.
And this area of the inguinal hernia, there was a little swelling there, I know.
Yep, and
is that returning or?
Maybe.
Yeah, this fluid yesterday.
It's okay, buddy.
And the bruising's looking a ton better.
But sometimes just kind of described it perfectly with the pendulous
abdomen,
swelling.
Yeah, there's a little seroma in there, and because there's a space between the skin and the incision, so there's blood that's collected there, and I think we're just going to leave it such. But the bruising is a lot better.
Yeah, it's a lot better. Yeah.
The big thing is going to be rehab. That's going to be the most important thing.
Yeah.
And is he on an appetite stimulant? Did they put him on?
I don't think so.
Okay, I'll give you an appetite stimulant to take with you too, because that'll kind of increase his.
Okay.
It'll stimulate him to eat also. It works fairly well. So I'll do that, but I'm going to let Dr. Jamie do her magic, because she's a magic lady now.
Okay.
Are you good? Yeah? You like having your doggy home? Yeah? You're such a talkative little girl, except when you're on camera, huh? She looks like Shirley Temple, doesn't she?
She's adorable.
All right, I'll get you the appetite stimulant. I'm going to let Jamie take over. Nice seeing you guys. You're welcome.
Hi, buddy. Hi. It's so good. That's so good. All right, so I'm going to move him to the floor so we can just kind of hang out down here for a little bit. How's he been as far as getting up? How have you guys been moving him? Has it been okay for you guys?
We've been very anxious.
It's a little scary.
Yeah, I'm sure, but you're not going to do too much, so don't worry. Hi, I'm Dr. Jamie Mabius. I'm a licensed human chiropractor with a postgraduate certification in veterinary spinal manipulation, or animal chiropractic, and veterinary massage and rehabilitation. I'm the rehab therapist here at the Milwaukee Emergency Center for Animals. I have been certified in animal chiropractic for 2 years now, in animal rehab for just about a year. Nope. Good boy. Good boy. I'm gonna do a little laser on him again. It seems to really help, not only for the bruising, but also for some pain relief back here. I love working with the animals here. It's just such a wonderful part of my life. I grew up riding horses and working in the veterinary field, and then went on to human health care. So it's great to be able to utilize the two together, take treatment modalities from the human field and the veterinary field and mesh them together to give these animals a greater quality of life and get them moving a little bit better so they have a full life that's pain-free. So what the ball does, it helps to support their body weight. So what I'm just trying to do is just trying to get him to bear weight evenly on both of his hind legs. Then with this, I can very gently roll the ball forward and kind of encourage him to take a couple steps while I support his pelvis. I can then roll it backwards and try to encourage some backwards walking. This one's a little bit harder for him, but at least gets his body to remember that movement and encourage that movement. So I first saw Archie this past Monday, so that was about 4 days ago. He was hit by a car the previous week. So I saw him to kind of get a rehab plan together, see where he was at this point, and develop a plan going forward, what we could do for him to stabilize his pelvis and give him the best quality of life going forward. But yes, going forward, yes, underneath his butt, keep his pelvis nice and level. That'll just encourage just better healing of his pelvis. Because again, that's going to take the longest. It's probably going to be another 5 to 7 weeks for that to fully heal. Okay. But he's definitely a trooper. He's doing so good. Yes, you are.
How long do you think until he's like able to? I know we'll have to restrict his energy, but at what point is he going to be able to like walk out the door and go to the bathroom?
That's going to be honestly dependent on him and kind of how he's doing, how he's feeling. I don't want to push too much too soon on him because I don't want to take him any steps backwards. Yeah. So it's probably going to be at least another 3 weeks. I'm really excited to see Archie's progress over time. There's definitely a lot of work for us to do. He has a fractured pelvis right now, so we have to bide our time with that, give him the proper time to heal. Don't want to push him too far too fast. But going forward, I really am looking forward to his outcome and seeing him live the rest of his life happy and healthy and running around with his little kids at home.
Ruby's a therapy dog, so she goes to the hospital with mom and dad to visit with patients. They said that she has great effects, especially with patients with Alzheimer's and other forms of dementia.
She's a cute little doggie. She had a discharge from her back end for the last 5 days, and they treated her for diarrhea, they had thought it was, and put her on some medications for diarrhea. It never cleared up, and then she stopped eating. And then today she looked really sick. Is that true?
Oh yeah. Oh.
And when she presented here, Mom was really worried about her because she wasn't eating. She wasn't even walking. She was that weak. She was getting that weak. So when she presented here, we took one look at her, and she just looked so sad and dry. She's got discharge from her nose. Her eyes are even all mucusy because she's so dehydrated. And she's a cute little doggy. Chin, right?
Mm-hmm. Chin. Little Chin Chin.
Yeah, Chin Chin is the breed. And they're an adorable little breed. and her color of her mucous membranes are a little bit pale. Muddy, we call them. Not nice and pink. She's very weak. She can hardly stand up, and she's got a vaginal discharge. So that's all, instead of being diarrhea, that's all coming from the vulva. So she has pyometra. So the owner has opted to get going on her, doing blood work, get her hydrated, get her stabilized, and then later on this evening she'll have surgery done.
So today we've got some finches here, and they have, if you look here in this, there's a little egg right down in that basket, and these finches are laying eggs. They just had a clutch of babies, and they're old enough, they're eating. The owner brought the 3 birds in. You'll see there's only 2 in the cage right now, and we separated the baby because the parents were picking on the baby. So these parents, now that they've got this egg in the basket, want to protect that, and basically the other baby got booted out of the nest. Just a tiny little guy. In fact, the owner didn't have a name, so we just called him Tiny. And if he flies around, I don't know if you can see, but he's in an area of feather loss due to the parents picking at him. And we are going to empirically treat this little guy for mites, and we will separate the baby from the parents. That's what I told the owner to do. When birds get stressed, they can become infected with mites, and it's usually immune related. So the stress of the parents picking on the baby suppresses the immune system, and the baby gets mites. So we're gonna go ahead and treat for mites. Alrighty, so get this little guy out of here. Okay, so we got our little friend here, and you can see this all over the body. He's just got this feather loss. So on the chance that he could have mites, we're just gonna go ahead and treat this little guy. So Chad's gonna go ahead, we're gonna put a drop right over the jugular. And that's it. There, so now he's treated. We're gonna separate this little guy. And that's that.
This little bird came in this morning, and it's been kind of exotic days, so there's those days that's what we mainly see as exotics, because not a lot of the clinics in the area see exotics or emergency care. So this little bird came in this morning, owned by a little old man, that his thing was he had a neighbor taking care of his bird for him while he was gone out of town. And he told the neighbor that he had 2 parakeets, and the one parakeet does not like the other one, so it attacks this bird. So he told the babysitter, when she comes in to feed them, to not put the 2 birds together, leave them in their separate cages. The babysitter decided she was going to try them together, because she decided that no, that's not a good idea. You should have 2 birds together. So she took it on herself to put this bird in with the other one that doesn't like it, and that bird just attacked it. So now we're putting it, we gave it some sub-Q fluid. See, it has an injury right above the eye here. And so he attacked him and caused some head trauma to the bird. And then he's got some bruising underneath the cheek here. And he's also got one of his wings is hurt, and he's got some marks on his feet. The bird attacked, and then he attacked him on the body too, right here. So there's some blood on there. Everybody thinks that birds fly around, and they see them flying in the sky and everybody likes each other, but that's not true. A lot of birds will fight with each other, and they're always watching each other, even out in the wild, that other birds will pick on other birds. So we always tell people that if you have a sick bird, you need to come in here immediately. Because a sick bird that's sick for 12 hours means it's had something going on for a while, and then all of a sudden it shows its sickness and then it dies, because this is an innate quality that they learn from the wild. Because birds in the wild, if you know, if they're with their flock and then they start to show sickness, the flock will either peck them to death or throw them off of a tree branch, or they'll just leave them behind. So it's a known quality that the birds try to hide their symptoms up until the last minute when they're sick. So just a word of warning to all people that when they have a bird that's showing any type of sickness, even a little bit of being lethargic or not eating for a couple hours, when they wake up in the morning, they see the bird hasn't eaten in the morning, they need to get it right in here, because that means the bird is really sick.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
There's been a lot of excitement at Haws this year, from newsworthy animal rescues to helping everyday people adopt a new family member. We at Haws know we couldn't do it without the help of people like you. Help us continue our success in fulfilling our animals' needs by donating to the Haws Two-Step Project. By making a general donation and pledging to donate toward our much-needed future expansion, you help us continue the Haws mission of helping animals in need. Log on to hawspets.org and donate today.
Humane Animal Welfare Society.
Today's show was brought to you by Haws, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.